My name is Eleanor, and I will be talking about autism in the following presentation. Spectrum disorder, or ASD, is a complex developmental disorder that starts early in life. The disorder presents with persistent social deficits and restricted, repetitive types of behaviors, interests, or activities. Individuals experience a host of comorbidities such as intellectual disability, seizures, epilepsy, ADHD, anxiety, gastrointestinal conditions, and sleep disturbance, to mention a few. The typical time of diagnosis is at or after 4 years of age, but can be as early as 2 years of age. While the causes and disorder pathways are not well understood, research indicates that genetic heritability is responsible for up to 90% of the disorder's expression. Prevalence of autism in the United States is tracked by the Centers of Disease Control and Prevention in collaboration with the Autism and Developmental Disabilities Monitoring Network. For national estimates, surveillance data collection is conducted among 8-year-old children in 11 nationally representative tracking sites across the country. At the national level, prevalence is 168 per 10,000 individuals. You may also see numbers such as 1 in 59 children have autism, which is the same rate but expressed differently. As you can see from this slide, the national autism rates have been going up over the past decade or more. However, it is not clear that the increase in prevalence rates is due to an actual increase, or whether changes in the definition of autism or better access and diagnosis tools for the disorder are responsible for the higher prevalence rates. On the local level, we have limited data to compare prevalence rates regionally and nationally. As San Diego and California are not part of the CDC tracking sites, we have to use different data sets. The State of California Department of Developmental Services, DDS, provides autism data for California based on the data collected by regional centers who provide services for individuals with autism. While the data is not directly comparable to national rates, regional differences in prevalence can be identified. For example, rates in San Diego County are higher than the state median. Within San Diego County, rates in northern neighborhoods such as La Jolla, University City, Carmel Valley, and Ranchos Penasquitos are more than twice as high compared to the rest of the county. Disparities have been found for gender, socioeconomic status, and racial or ethnic background. What is interesting is that higher socioeconomic status is associated with higher rates of autism. Similarly, white children have a higher risk of being diagnosed with autism. These disparities are likely not due to higher prevalence among this population, but rather a result of greater awareness, higher likelihood of identifying developmental delays, and access to qualified professionals who can diagnose autism. These disparities in diagnosis may be due to parental differences, which include higher education, but also due to differences in healthcare providers. Research shows that providers tend to screen minority children less frequently for autism. This may be due to socio-cultural difficulties in communication with those affected or biases by providers. The fact that providers may expect prevalence to be lower among minorities might mean they are not expecting and looking for it in those populations. As can be imagined, whether diagnosed or not, autism has a profound impact on the quality of life of those affected and their families. At the individual level, those with autism have difficulties understanding social behaviors and expectations. They tend to have heightened sensitivity to sounds, smells, food textures, and flavors. This results in behaviors that are different and make them stand out in social and public settings. This may expose them to bullying, discrimination, and as a consequence to social exclusion and isolation. Isolation is keenly felt by individuals with autism. During childhood, these experiences are highly influential on child development and may have significant negative impacts if experienced during sensitive developmental periods. For the parents and families caring for an autistic child presents significant challenges. Families have to adapt their lifestyle to accommodate the all-encompassing needs of an autistic child. Children with autism are very sensitive to changes in routines, which can be constraining to family life. Additionally, parents are experiencing stress and potential emotional and mental issues as a result of caring for an autistic child. As parents are struggling with their own challenges, their ability to care for and support their child's development is likely impacted, resulting in greater risk of poor health outcomes for autistic children, both related to autism and comorbidities. Include Autism is a nonprofit organization in San Diego working with children with autism. Their mission is to empower individuals with autism by providing community access and meaningful skill building programs while engaging the community through outreach and education. The organization was founded in 2003 and is serving school-aged children with autism across San Diego County. The key programs offered are the Community Coaching Program and Autism Inclusion Training. The overall goal of these programs is to facilitate and promote autism inclusion in all aspects of the community. The Community Coaching Program is designed to teach social and behavioral skills to autistic children. The key is that these skills are taught in a group setting in the community. Children go into community settings, for example, the grocery store, to learn how to behave and interact in this environment. This is an innovative approach compared to the traditional in-home one-on-one skill training. The autism inclusion training, on the other hand, focuses on community awareness and acceptance. This component is aimed at community organizations and businesses. Include Autism provides education and training to businesses so they know what to expect when they encounter autistic children and how to appropriately deal with them. One example I wanted to share how Include Autism approaches community inclusion is the example of outings to the airport. As part of the coaching program, autistic children regularly visit the San Diego airport. This can be a difficult environment for us all to navigate. So at the same time, Include Autism is collaborating with the TSA and providing training and education to agents to prepare them to deal with autistic individuals. And here is a photo of children at the airport. I love the curiosity evident in these kids. Finally, what is most needed by individuals with autism? We need to find better and effective treatment options. Very little evidence-based literature is available regarding treatment efficacy. This means pediatricians and parents do not have scientifically proven information to base their decisions on treatment options. Parents may use up to 7 treatment regimens at a time for their children. Trial and error appears to be parents' approach to selecting treatment options. With the increased availability of cannabis products for medical use, cannabis is becoming a new focus for parents and researchers. New trials to understand the efficacy of specific cannabis-derived components addressing autism symptoms will start next year, one of them here in San Diego at UCSD School of Medicine. The second focus should be on reducing stigma and social isolation. This is where the nonprofit Include Autism comes into play. Inclusion, acceptance, and reduced stigma are their mission. A specific focus, they point out, will be the young adult population who are transitioning out of school services into adult services. This age group is at high risk of social isolation due to the limited services available once they reach age 22 and over. Individuals then tend to rely on regional centers and state-funded services. Funding of these services is very limited. The result for many is extreme social isolation and an existence in assisted housing or centers that resemble adult daycare. Funding issues are the key reason for the lack of services for young adults. In other words, we need to find effective treatment options, funding for adult services, and increased community integration and acceptance in order to provide those with autism a chance for an independent and fulfilling life.